Hey everyone, I'm Dr. Konrad Sarosiek here at Cool Springs Plastic Surgery, and I'm here to talk to you about breast reduction. A lot of folks call our office with an inquiry and they're wondering, what do I need to do before I undergo a breast reduction? What are some of the steps involved in the process, and how do I get my insurance company to check my records, my file, and see whether or not I'm approved for the surgery? And then how do I go about scheduling an operation? All of those questions are very difficult, and we as plastic surgeons frequently see them, sometimes on a daily basis. And it is our feeling that we thought we'd put this video together to try to help answer some of those questions for you before you even have an operation. So, congratulations to most of you for taking that first step and spending a few minutes watching this video. We hope you enjoy it. So a lot of women come to us with pain in their shoulders, in their back, in their chest, in their arms. Sometimes folks exhibit signs and symptoms of numbness and tingling even in their hands because their chest is so heavy. A lot of women experience rashes under their breasts, which can lead to them seeking medical care like antibiotic creams or even oral antibiotic medications. Those are some of the common symptoms that we find in patients who have very large breasts and who medically might need to have a breast reduction. For those individuals, the process is very intricate and there are multiple steps involved. The important thing is that, number one, you understand which insurance company you are with. Number two, you understand that insurance company's process for getting your breast reduction approved. And as most of you probably know, the insurance companies are all different. They all have different requirements, and it's kind of difficult sometimes to figure out exactly what they want. So we hope that maybe today we can show you how to find that information and make sure that you're doing everything, that you're dotting your I's and crossing your T's prior to undergoing this operation. So here we go. Again, I'm Dr. Konrad Sarosiek from Cool Springs Plastic Surgery in Nashville. I did want to mention that we will be showing some patient photos, and if you're watching this video with children around or others who might be sensitive to such images, I would ask maybe that you pause the video and continue it at a later time, or maybe ask those individuals to leave the room so that you can view this video privately. So wanted to get that out there. Here's our agenda. So we got a few bullets we're going to cover, and I know it's hard to see this from where you're sitting right now, so I'm going to try to read some of this out to you. So number one, what do I need to do before seeing my plastic surgeon? Incredibly common question, comes up all the time. Number two, what can I expect during the consultation visit when I go see my plastic surgeon? Three, how does insurance determine how much breast tissue to take off of your chest? It's not an arbitrary number. There's actually a formula to it, which we're going to review so that you're better prepared when you meet with your surgeon. How's the surgery done? We're going to talk about that. What are the common complications that folks undergo or can happen? And what is the recovery like after this procedure? What do you need to do to prepare at home with your work, with your job, to make sure that you have a successful journey? Now, I always tell my patients that any operation is not like a car wash. It's definitely like a journey. So you have to prepare yourself for that because there's always a recovery period. And it's important to make sure that things are properly arranged at home so that you can have a safe and exciting recovery as you begin enjoying the new you. So let's talk about this. What do I need to do before seeing my plastic surgeon? Now, this is very, very important, and this does not involve the plastic surgeon. However, it involves your primary care doctor. Most, if not all, of the insurance companies that we work with have a system set in place where they need to determine whether or not a person who has large breasts truly needs to have a breast reduction. Obviously, the dangers of putting someone through an operation, before that happens, the insurance company wants to verify that what problems the patient is experiencing in their shoulders, in their neck, in their back, in their hands are truly attributable to the size of the patient's breasts. So the process begins at your primary care doctor's office. It's very important as a patient for you to have a very informed discussion with your primary care doctor to discuss some of the symptoms that you're having, and ultimately to let the primary care doctor know that you attribute a lot of the weight to the weight on your chest, which is primarily held in your breasts, and that is what you believe to be the cause. The primary care doctor at that point will have a discussion with you, do a physical exam, and more than likely recommend some medical management treatments. Those treatments are a multitude of things. Some of the ones I'm going to mention here. They can prescribe for you to take a non-steroidal anti-inflammatory medication if that's something that is appropriate for you. Number two, they can prescribe for you to visit with a physical therapist. And a physical therapist at a point would see you and look at your body and try to help you come up with exercises that over a few weeks to months can contribute to strengthening your back to help give you more support so you can reshape and get your posture back. So we talked about non-steroidal anti-inflammatories, we talked about physical therapy. A chiropractor also is very commonly used, where somebody can visit a chiropractor to see if some acupuncture or things like that, or spinal manipulation can potentially help alleviate some of the pain. What this process is doing is trying to eliminate other causes for your back pain. It's trying to ensure that other reasons that your back might hurt are not causing your pain and that it's truly attributable to your breasts. Other things that they can do is provide for you some exercises to do at home, other medications, hot cold therapy. There's a multitude of things, and every insurance company has different stipulations for their own patients, and I'm going to show you how to find those requirements. But that process begins with your primary care doctor. Now let's say you went to your primary care doctor and had this discussion with him or her. They would then send you to a physical therapist or ask you to take this prolonged course of non-steroidal anti-inflammatories. And that process can take anywhere from 4 to 6 months. So it can be a drawn-out process. During that time, it is important that you continue to do what the primary care doctor has asked you to perform. Meaning, if you're going to see a physical therapist, go see the physical therapist. If they give you exercises to do for your back, do those exercises for your back and see if that helps your pain. If they ask you to see a chiropractor, do that, and so on. And at the conclusion of that period, so somewhere around that 4 to 6 month window, the important thing is to go back to your primary care doctor and ask that doctor to document in their chart that, wow, this patient underwent medical management of their back pain. And either A, the patient feels better and they don't have back pain anymore, and it is not because of their breasts. Or you return to that primary care doctor's office and you're still having that back pain. You're still having that shoulder pain. And if that's still persisting, the primary care doctor at that point will document that you have failed medical management. And if that's the case, they will then recommend for you to see a plastic surgeon to help with a breast reduction to help alleviate some of that pain. So the point I'm trying to convey is the process before you see your plastic surgeon can be a long process. It can take 4 to 6 months, and it's important for you as a patient to understand that prior to coming to a surgeon, to have that all taken care of, because of the fact that it can delay or prolong your time until to the operation, should that operation be appropriate for you. So let's say you've done all that, you went to your primary care doctor, you did the exercises, and nothing really helped. You're still having the pain. You have a size G, F bra, and your chest is just so heavy and you continue to have problems. At that point, your primary care doctor will then write that note, like I said, because it's about documentation, right? It's very important to have that note written in their chart, and then they'll send you to a plastic surgeon, and the plastic surgeon will meet with you and discuss the surgery. Now, before we go to the next step, before we go to meet with the plastic surgeon, what I wanted to show you, and I know that you cannot read this, but we here at our office primarily accept 3 insurances. We accept Blue Cross, Cigna, and Aetna. And I wanted to show you kind of what you're looking for on the internet. All of these documents are widely available. You can literally go onto Google, Yahoo, Bing, whatever search engine you use, and find them. And they're really easy and they're very explanatory as to what you need to do. So basically, I went on to google.com and typed in Blue Cross Blue Shield of Tennessee breast reduction guidelines, and immediately a website pops up and it shows me everything that needs to be done. It shows me what symptoms Blue Cross Blue Shield of Tennessee wants our patients to experience prior to having the surgery. It shows us what things that they want you to try before. And I'm going to show you some things here They say that some of the things they want you to do is a 6-week to 8-week history of using an appropriate support bra. They want you to do appropriate exercises to strengthen your back. They want you to try using hot and cold treatment for your back to see if that helps, or using non-steroidal anti-inflammatory medications. So that's Blue Cross's requirements for Tennessee. Now, if you're watching this in Alabama, Kentucky, New York, Oregon, Washington, wherever, your state's policy might be a little bit different. So not all of them are the same. Just because they're part of the Blue Cross network does not mean that they follow the exact same rules. So once all that's done, this is Blue Cross's, right? I'm going to show you guys another one. Here's Aetna's. So this is Aetna's policy. Again, I found the same thing online using the same type in a search engine. Here's Cigna's policy. So again, very easy to find. I would urge every one of you to go ahead and do this. One of the big caveats of this operation for patients, and it can be a challenge after the operation, is that insurance companies reserve the right to deny your claim after the surgery's even happened. So that sounds pretty scary. Why would they deny me if they've approved me for my surgery? And the question then becomes, did you do the appropriate documentation? And this is why I try to stress to our patients here at Cool Springs that it's very imperative you take the time and do this appropriately on the front end so that your recovery and everything thereafter can be bliss, okay? So let's continue on. So let's say you get through all of this stuff, you got all your documentation done, now you're going to see your plastic surgeon. So let's see what happens there. What can I expect during my consult? What is going to happen when I see and meet with my surgeon? The most important thing for you is to meet with your surgeon and see if you connect. Again, this person is not going to be like a car wash that you just drive through and leave on the other end and it's all done. It's a journey. The recovery process from this is a journey. It involves several follow-up visits. So I would encourage you to find someone that you respect, someone that you work well with, someone that you feel comfortable with, because ultimately it's your body. These are your breasts, and this is incredibly important for the rest of your life to do a good job on your operation. So meet with your surgeon, gain confidence. Again, this is also an opportunity for you to look at their photos, their before and after photos. What kind of surgeries are they doing? What kind of patients have they operated on? Where do they do their operations? Are they operating in the same surgery center at their office, or are they going to a hospital somewhere far away? Review those photos that they have on their websites. A lot of surgeons have great websites, some don't, and you should ask why, because it's important for you to know what kind of operations they're doing and how those operations are being done. So the surgeon themselves should spend a little bit of time reviewing your history. They're going to make sure that you have all of that documentation all set up in your chart and you're ready to go. And again, that's not to prolong the consultation, it's just to make sure that on the back end, after the surgery, there's not a point where the insurance company starts to question what you did and why was it done. Ultimately, remember what I said, that the insurance company reserves the right to be able to deny people on the back end, and that's not fair, especially if you've done things correctly up to that point, and if you've undergone the proper operation, you should be good to go. Next, they're going to take a look at you. They're going to take a look at your chest, listen to your heart, lungs, and they're going to measure your breasts. And this is incredibly important to get an understanding of what size we're talking about. There are a multitude of different ways of doing breast reductions in patients, and those operations can be performed safely, different operations for different patients depending on the measurements of their chest. I would tell all of you to be wary of somebody who doesn't measure your chest when you're in a consultation. You want somebody who's going to be able to look at the numbers and determine the proper procedure for you going forward. Then they're going to do this really incredible thing that the insurance company mandates. I know some of you out there have a size G breast or F or even bigger. I mean, we've seen very large ones, and I'll show you some pictures coming up here. And a lot of you come in and say, I have a size G, I want to be a size C. Or you say, I'm a size double D and I want to be a full C when we're done. So we as plastic surgeons doing an insurance breast reconstruction, we don't have the ability to decide how much breast tissue we take off. And that sounds really strange. So listen to that again. We don't decide with insurance how much breast tissue to take off. If you were to do a cosmetic breast reduction, meaning you came to see us without insurance, you came just to pay a fee for an operation to be done without insurance coverage, at that point, we can discuss what size you'd like to be afterward, and we can custom design your breast reduction for you to get you as close as possible to that size. However, with an insurance reduction, the insurance company determines how much breast tissue is removed. And that is done using your body surface area, which is measured based on your height and your weight, and is computed using something called a Schnur scale. It sounds very bizarre, sounds German, nevertheless, it's a scale that's been around, and I'm going to show you how all of this works. So we as surgeons, we don't really get to decide how much to take off. The insurance company mandates a minimum amount of tissue that has to be removed from each breast. And if that minimum amount is not met, unfortunately, the patient in that operation does not qualify for a insurance-based breast reconstruction. So important things to consider there, right? That's a big piece of news, that it's not up to us and almost not even up to the patient, but it's really up to the insurance company. So let's talk about how all that works. And then after we discuss all of that, then we would start the insurance approval process. And now here's the kicker. So think about the timeline here. You've had this issue. You saw a primary care doctor for 6, 8 weeks, 4 months, 6 months. You underwent what we call medical management with the physical therapy, chiropractor, hot, cold packs, all those different things. And then you go see your plastic surgeon, and then they submit you for insurance coverage. This process to get insurance approval can sometimes take months to accomplish. The insurance companies sometimes can take so many weeks to process paperwork, then they can request additional paperwork, which we have to send them, and then they have to review that. And sometimes they have to call the doctor, schedule a time to have a conversation with them before it's even approved. I've seen this process take anywhere 6 to 12 months to complete for a patient. So if you're considering the surgery, an important bullet point to take away is think about the timeline of this. Think about the timeline and do things for you when you know they're going to line up so that you have childcare if you need it, because a lot of women have young children at this time after that come in for consultation. Make sure that you don't have any major vacations planned that you're going to be leaving soon after surgery. Make sure that you've got appropriate help at home, whether it's with your spouse or with another loved one, or even with your neighbor, someone to help you get groceries, etc. Important for you to kind of make a plan for this timeline. So let's keep going. So this Schnur scale, how does insurance determine how much breast tissue is removed for a breast reduction? So it's based on your height and your weight, okay? Your height and your weight play a large role in this, which means that the taller you are and the heavier you are, chances are the insurance company is going to want to have more breast tissue taken off of your chest. So we use that height and weight to compute what we call a body surface area, and all insurance companies are a little bit different as to the calculation that they use for that. And then we use the body surface area to look at a Schnur scale. And I'm going to show you guys what that looks like just to get everybody on the same page. So here we go. This is an amazing example. This is a 55-year-old patient who came to us who is 5 feet 3 inches tall, right? So she's 5'3", so she's about 63 inches and weighs 160 pounds, okay? So about an average sized woman came in. Using the body surface area calculator, which again, these are all things that you can find online. You can find this online by going to google.com or Bing or Yahoo. Actually, I'm not even sure if Yahoo's around anymore, or Bing, but Google seems to work well. So calculate the BSA. Once you do that, then we go to this scale, and I'm going to show you what it is. Here it is. This is Blue Cross's scale. Again, every insurance company makes little adjustments in the scale based on their numbers and their requirements. This is all easily found on those insurance companies' websites. So again, all at your fingertips on google.com. So using that number, we came up with 1.79. So here, I know it's hard to see this, but 1.79 is equivalent to 422 grams of breast tissue, okay? Now, this is where it becomes important for you to understand that. Most of you at home are probably like, well, how much is that weigh? How do I know it? How much is that gonna be too much, too little? What does that mean? And that's where your plastic surgeon, that visit, that consultation is incredibly important. Because once we know this number, we can then, during our exam, look at your breast. And as we're looking at your breast, we can feel the weight of it, and we can feel a comparable object of comparable weight. And we usually let our patients feel it for themselves. And as they are feeling their breast and they're feeling this object, they say to themselves, wow, this is a lot of weight that they have to take off. I feel like I'm going to be left with an A cup, and I don't want that. In that case, breast reduction might not be the right procedure for you. However, for a lot of our patients, they're like, oh my gosh, that's it? They only want 442 grams? I will give them 1,000. Look at my breast. It's so big and so heavy, and it's just causing me so much pain. For those patients, a breast reduction is a great procedure, and it will truly help them achieve their goals. Now, if an insurance company says, according to the Schnur scale, that they want you to take off 422 grams, like for this patient I just talked about, if your breasts are much larger and weigh a lot more than that object that we give you to weigh that weighs 422 grams, if your breast is bigger than that and you want your breast to be smaller, we can make adjustments and take more tissue off. I want to be clear on that point because it's really important. We, as plastic surgeons, can take more tissue off to make your breast a little bit smaller if that's what you would like. However, we have to take off that minimum weight of 422 grams. So I want to make sure that you guys understand how that process works, because it's very important to have a good understanding. The worst case scenario is you wake up from surgery and you look down at your chest and you didn't know how much was being taken off, and you say to yourself, oh my gosh, what happened to my breasts? You don't want that to happen. So it's important to have that discussion with your surgeon. Watch this video. I'm happy to talk to you about it if you're here locally. If not, man, there are so many great plastic surgeons out there in the surrounding area and even in the entire country. They're everywhere. They're great, great doctors, and they'll help you on this journey to get this taken care of. So, Schnur scale determines how much weight we need to take off the breast, and then getting a feel for that weight versus your breast tissue can help approximate what size of breast you'll be left with after the operation. Now, next, a lot of people ask, hey, what's the recovery period like? What am I going to be like after surgery? How's this all going to feel? Most patients, and this is one of the greatest things ever, this surgery truly produces almost an immediate relief of back pain. Despite you having an operation, a lot of folks in the recovery room after surgery will say, oh my gosh, I already feel better. And that's incredible. You just underwent an operation, but you're already feeling better. So some of you can imagine what that means for those patients. But what you can expect is this. We tell our patients to take off between 1 to 2 weeks of time out from work, if that's safe for you to do so. Most patients don't need the full 2 weeks. However, if you do, that's okay. You've got it reserved. If you don't, then you can always go back to work a little early, okay? So that's important to know. A lot of patients use FMLA to help them financially stay secure during that period of time to make sure that there's still an income for their family, their children, their loved ones. There are some rules associated with this surgery, and I know a lot of people will probably not be too happy with these rules, but they're part of the healing process and they're important to know. And these rules can vary based upon surgeon to surgeon. These are my personal rules, but they might be different for the surgeon in your area where you're seeing this video. Number 1, only sleep on your back. We do not want you sleeping on your chest after the operation until everything is nice and healed. And that's very important because you have fresh incisions on your chest. And those incisions, if you put a lot of pressure on them by sleeping on your side or on your back, can potentially damage those incisions, and that is not a good experience to have happen to you. Number 2, do not lift more than 5 pounds for 4 to 6 weeks after surgery. And I know a lot of you are thinking, oh my gosh, I don't know that I can do that. 5 pounds is about a half gallon of milk. For those of you with small children, it probably means that you take some time to set up appropriate help at home with those kids. And it's important for you to take those steps because, again, if you're trying to lift something heavy on your chest and something tears or pulls, it can potentially lead to a complication like bleeding in your chest or a hematoma or a big bruise. And that's not something we want to have happen. So we ask folks to arrange for some help if they need it at home, maybe a neighbor, a friend, a loved one, just to help out and make sure that you have some help and support during that period of recovery. And I tell my patients, this is my personal thing, no shower for about 5 to 7 days. Some doctors are different. Some will let you shower earlier on. My personal concern with that is that a lot of times we can't really, we can't supervise. We don't know how you're healing because we don't see you back for a week after surgery. And even though that wound is closing up really quickly, we're not sure how everything is looking underneath until 1 week out. So we try to give it as much time as possible for that skin to close over top, underneath of what I use steri strips, just to make sure that everything is healed up and nice and smooth before you put water or any kind of lotions or fluids or anything onto your chest. So no shower 5 to 7 days, sleep on your back, and don't lift anything over 5 pounds. One of the greatest things about this surgery is what I mentioned earlier, is that patients feel so much better so quickly. A lot of folks are taking pretty heavy doses of pain medicines because their back pain is so bad. And it's pretty incredible how quickly after this operation, patients will say, my gosh, I have no more back pain. Doc, I only took 1 pain pill after this surgery. I feel like $1 million. Some patients will say, Doc, oh my gosh, I'm an inch taller because I can stand up straight now rather than being hunched over because of my breasts. And it's an incredibly rewarding feeling for us as surgeons, as patient caregivers, that we truly feel grateful that you allow us to participate in your care and to help you accomplish some of those things, and to help make your life and quality of life better, right? That's what we're all after, to have a better life. Okay, how is the surgery done? This is important. Number 1, we put you under general anesthesia. So it's not uncommon to have doctors ask your primary care doctor to write a letter stating that your medical management, your medicines that you're taking, are optimized prior to surgery. Putting you under general anesthesia can cause different changes in your body, and it's important to make sure that your heart and your lungs and your kidneys, everything is functioning well. And we give the doctors at our office, we ask the primary care doctors to help us with that. Since they know you very well, they've seen you for a number of years, we ask them to help you make sure that your body is properly tuned for this operation, so that when you go into it, you have no complications and you just glide on out, and then you're going to have a very easy recovery. Versus folks who potentially might have some heart or lung issues that might need to have some of their medicines changed. Sometimes we'll have doctors start patients on a new medication, a new inhaler or something. Maybe we'll do a EKG on them, a chest x-ray, just to make sure that everybody is doing okay. Next, there are many different scar types, and there are probably 10 to 15 different ways of doing a breast reduction on somebody. The scar types vary, and a lot of them depend upon your measurements. Remember, I mentioned that earlier, that that's something that your surgeon will determine when they meet with you during your consultation. So very important, get those measurements, and the scar types can be altered depending on what are the size of your breast and the shape of your breast. The typical scar patterns that we use for breast reduction are either a lollipop or an anchor. And I know most of you are thinking, is he speaking in baby tongue? What in the world is he talking about? So I'm about to show you what that means. So this is a picture of a breast, and obviously this is not a human, this is an artistic representation of one. But the lollipop portion of the breast reduction, so if you're able to get yours done through a lollipop incision, what that means is you would get an incision around the nipple and then down to the bottom underside of your breast. And that's applicable for some folks, but not all folks. And a lot of the really larger breasts, it's very difficult to do something like that. A more common way, or a more readily done way, is called the anchor scar. And I'm going to show you what that is. And that's basically where you go around the nipple, you have a scar going down to the bottom of your breast and a scar across the bottom of your breast. So it resembles an anchor from a ship. That scar allows us to manipulate much larger breasts, although some doctors would argue that you can even do larger breasts through a lollipop incision, and that just depends on your doctor's level of education and your doctor level of comfort. Again, some things work better in certain individuals' hands. So there are some complications associated with a breast reduction. So whether they do a lollipop or whether they do an anchor on you, once your surgery happens, there are some potential complications, and they're very important to discuss. Asymmetry. Asymmetry means that your breasts after the operation are just slightly different. And in surgery, and especially in breast surgery, we commonly use the term that breasts are like sisters, they're not twins. So there's always going to be some discrepancies between the two breasts. Even for you sitting at home now, if you look at your breast, chances are one might be a little bit bigger than the other. One might be a little bit more lateral than the other breast is. Our goal during an operation is to put your breasts right in the middle where we think that they are supposed to go, that are symmetric, full, and looking amazing. However, everybody heals differently. Everybody's chest walls can be different. The breast tissue can be different. One side might have more dense fibronodular nodules. One side might have more cysts. It's difficult to tell. And the goal for us during surgery is to do the same operation on both sides to give you two beautiful symmetric breasts. However, at some point after the operation, there's always a chance that you might have slight differences in your breasts. Number two, infection. Infection can happen during an operation or afterward. And those infections, we give patients a dose of antibiotics before the operation just to help and protect them from that. But the most important part about an infection is to have your doctor continuously follow you. So again, back to the analogy, it's not a car wash, right? You don't just drive through and then you're out and you're done. There's a recovery process. For my patients, I see my patients back 1 week after surgery, then I see them at the 2-week visit and at the 4-week visit and then beyond. So there's definitely a period of time where I'm watching my patients very closely to make sure that their incisions and everything that's going on inside of their breast is healing as perfectly as it possibly can. Bleeding is a complication that can occur, and bleeding basically involves formation of what we call a hematoma, or a big bruise under your skin. It's not abnormal to have that happen to patients after this operation, especially for folks who try to do too much after surgery. So if you have an operation, you're feeling great and you get extra excited and you're like, I want to go home and vacuum my house. Not a good idea. I would caution you, not a good idea. Talk to your surgeon before you do something like that. Doing those kind of motions with your hand can potentially stir up bleeding and cause for you to have something that might not be might have a great outcome in the long run. Now, wound formation. This is an unfortunate complication of this surgery that can happen. And the wound formation that occurs is usually, if it's going to happen, it happens right at the very bottom on the underside of your breast. Okay? Well, this is the T point, as we call it, because you see this line coming across and the line coming down to it. So it's like an upside down T. And that spot, that exact location, the blood flow to that location is probably it's most difficult for your body to get good blood flow there, because it has to flow all the way down here, okay? And that area is prone to having a potential wound form if it's going to happen. It doesn't happen in everyone. It doesn't happen in most people. However, it can happen, and it's important for you all at home to be aware that this is a potential complication. The way we treat those wounds, if they happen, is we gently take a piece of gauze and lay it across the bottom and just allow you to slowly allow the wound to heal from the inside out. Usually takes a week or two and the wounds are completely healed and everybody does very well. However, during that time period, there might be a prolonged course where you might have to put a gauze or a bandage in that spot just to help take pressure off of it and allow the tissue in the wound to heal. Next, loss of sensation in the nipple. And this is a big one. A lot of women ask about this because they wonder, my gosh, am I going to lose sensation in my nipple? And there's a possibility of that happening. There's no real way to predict how it's going to happen. A lot of it depends upon your anatomy. Some of it depends upon how the surgery is performed, what pedicle we use. And pedicle is a medical term, but it's just how we cut the breast in order to move the nipple up. Because you can imagine if the nipple is down here, you can't just untape it and stick it up there. You can't do that, right? You have to move the nipple up there. And sometimes by the way we cut the nipple, the area around the nipple, you can potentially damage a nerve that might potentially lead to a loss of sensation. That being said, some people will develop what we call hypersensitivity, which means they have more sensation in the nipple. So there's always this kind of variability. And for a lot of folks, there's not much change in their nipple sensation, and most folks do quite well. if you do experience decreased sensation, that sensation can and usually will come back in a time period of up to 6 months after surgery. For those folks where it doesn't return up to 6 months, chances are that's probably not going to come back. But you never know. You just give it time and let it heal. But it's a real risk of the operation, and it's important for you to be aware of that prior to undergoing the surgery. And then the last one is possible loss of nipple. And this is again it's a scary complication to hear about, but it's a real complication. And it's something that everyone needs to know about, because this is not just going in for a mole removal. This is a big operation. You're going to be under anesthesia from anywhere between 2 to 3 hours. So the way that we end up having to cut the nipple to move it up into its correct position, we do have to cut through some blood vessels, because there's blood vessels all around our breast coming into our nipple. And sometimes the way that the nipple is cut in your anatomy, the way that your blood vessels run in your chest, makes it prohibitive. And unfortunately, we have no way to predict whether or not that will happen to you. It's something that only will manifest or become true after the operation. And usually if that happens to you, there are certain steps that we can take to try to help limit what's going to happen to your nipple and try to protect it as much as we can. Sometimes it's beyond our control and we have to let time take its course. However, for most folks, this is not a common complication and does not happen very often at all. Number two, if it does happen, once that nipple starts to settle in, it can happen to just a small part of it, just a very small, if you look at this picture, sometimes a very little half moon of dark tissue will develop, that tissue will come off, and then your nipple will heal underneath. Very rarely, but it can happen where the whole nipple ends up not surviving. And in those cases, we usually just let the tissue heal slowly over time, and at some point end up either reconstructing a nipple out of the skin around the breast, or potentially getting a tattoo, depending on what the patient's desires are. Unfortunately, it is a complication, and there's not much that we can do on the front end to try to protect you from that. We use very common pedicles that provide a lot of the blood supply to our breast and to our breast tissue and to the nipple, in the hopes that what we're doing is the best for everybody. But there are some folks that fall outside of that norm because their anatomy is different. Just like your two hands are different, the two sides of your face are different, your two breasts are different. So it is something real to be aware of, and something that I would urge you to either do more research upon or just to have an open discussion with your doctor about, because it's a real complication and it can happen to you. I will say though, sometimes folks, the sensation on the nipple, a lot of women who breastfed don't really care, and they say, I don't even care about the sensation. In fact, it'll be great if my sensation goes away because I have pain in my nipple already, etc. So sometimes complications are not bad. The cost can vary depending on where you're getting this done, whether it's done on the East Coast, West Coast, Tennessee, the South. There's a lot of different variability. Now, if you're pursuing this operation through a insurance company, which most of you, I imagine, who are watching this video are, that cost is largely provided for by the insurance company. I would urge all of you, if you're having this operation done, to think ahead and do a little bit of legwork on your own, where you can actually call your insurance company. They can look up your specific policy. You can ask your doctor to give you the specific codes that the insurance company will need, and then they will tell you how much the operation will cost for you out of pocket. And I know that sounds a little crazy, but you can find that information out, and it will help you prepare financially for something like this, to help make the whole experience smoother and better. So if you're going to do this through the insurance company, ask your plastic surgeon, what are the codes I need to give my insurance company? And then call your insurance company, provide them with those codes, and they will help determine how much of an out-of-pocket cost you can expect to have that procedure done. And then from a cosmetic perspective, so let's say you're doing this procedure and you're just doing it for cosmetic reasons. You don't want to have an insurance involved. You don't want to have as much tissue taken off, right? Remember we talked about that, where the Schnur scale determines how much. And if your breast is truly a C cup or a small D cup and you want to be a C cup, and the insurance company says, I want you to take up 600 grams, and that's going to leave you with an A cup. For those individuals who want to do this cosmetically, the price can range, but it's usually somewhere in the range of $8,000 to $14,000 in the Midwest, the South. is typically what we see here. I imagine it's probably a little bit more up in the Northeast, probably a little bit more out in California, but here around this area, I think this is about a typical range, and that does include the fee for the surgeon, the anesthesia, as well as the facility fee, which are the three kind of components that go hand in hand. That includes all of your post-op visits that you'll undergo after surgery, etc. Okay, next. So let's talk about some patients. I'm going to show you guys some pictures of what you can expect and what these scars kind of look like in real life. So this is a patient of ours who had very large areolas, very large nipple complexes, and very large breasts. Now, she was very, very, very young. She's a young girl who had difficulty in social settings at school where a lot of the focus fell onto her chest. So we're able to perform a breast reduction on her, and you can see here that her breasts are now shaped differently. They're a little bit higher up. Her nipples are up. They're a lot smaller. You can see a faint outline of the scars on both sides. You can see kind of the shape, and these breasts will continue to grow with her slightly, especially throughout the course of pregnancy. They'll get bigger and gain a little bit of weight. So it's not uncommon for folks who get this operation done at a very young age, and I'm talking, teenage years to the early 20s, to potentially require to have a revisionary operation done at some point when the patients are 30, 35, 40, after they've had children and after the breasts have grown a little bit. So very young girl, breast reduction. You can see the scar pattern, the small nipple complex. This is another woman. She's an incredible patient of ours who had very large breasts, and you can see how her breast literally, is resting on her abdomen. It's so big. Both breasts, you can see here, are very large. One breast is bigger than the other. Again, we talked about that, right? So there's some asymmetry already present in most of these women's breasts, or in most women's breasts, period. So you see that difference here. You see the nipple complexes are at different heights. This one is a little bit higher than this one. And here is her reduction. So we were able to take off what the insurance company wanted us to take off, but yet still we were able to leave her with a fairly proportional breast to her body. And you can see that here. This is a side view of her breast. You can see the shape, the outline. You can see that here. Here's the very large breast, and here's her breast now. She feels like $1,000,000. Her life has changed dramatically. She's enjoying her new chest and enjoying the new view on life that she's gotten after this procedure. And here's another young lady who had this procedure done. You can see kind of very large breast that kind of came down onto her abdomen. And after the surgery, you can see how the breasts are now much higher. The nipples are up and elevated on her chest. And the one thing I really wanted to show you guys is this. The scars, even though they're called anchor scars, those anchor scars sometimes on women whose breasts extend very far out here towards what we call the armpit area, right, to the axilla, okay? When the breasts extend that far, sometimes those scars have to go out that far. And it's important to understand that ahead of time, because all that tissue, we want to make that area flat. No woman wants to leave surgery with a breast here and an extra roll of tissue hanging underneath of her armpit. That's not fun. That's not an aesthetically pleasing look for a woman, especially if your arm is constantly going to be resting on that area. So sometimes we have to extend those scars way out into the armpit area to help remove and to shape that chest wall, just to help get rid of all that extra tissue, to make the breast a little bit more round, a little bit more shapely, again, to help reduce some of that weight that's there. So I hope you guys have kind of learned a little bit about breast reductions, what the process is like going into it. My goal for this is to try to be an introductory video to help you understand the process of what we need to do to get a breast reduction, how all of that works, because it can be very confusing. Frankly, it can be very difficult for someone to navigate who doesn't know what they're looking for. So I'm hoping that that helped you a little bit with that. I know it's a long video, but the good thing is it's over now, and you guys can go on about, enjoy the rest of your day. And if you have any questions, you feel free to reach out to us here at Cool Springs Plastic Surgery or at your local plastic surgeon's office in whatever area that you're watching this video from. So thanks so much. Thanks for watching, and hope to see you again sometime.